What's MEPs, guys? So we talked about MEPs in one of the videos before. MEPs, I know most of you guys already know it, but just in case some of you guys don't know it, which is okay, because I don't know the first thing about treating patients or anything like that anyway. MEPs, mechanical, electrical, plumbing, right? Mechanical, your HVAC, your air conditioning, your heating. Electrical, obviously your power, your lights. Plumbing is all your sewer, domestic water, and in most cases, it's your suction and your air. It's considered the same, but then that's also considered med gas. But let's not go off the rails. Let's just call it plumbing, okay? For sake of sanity, for even myself. So, as you guys know, my twin brother is a plumber, and I am an electrician. It's always a family hot topic. Anyhow, so MEPs, mechanical, electrical, plumbing, it's very important. Those are going to be your three biggest line items in your startup, right? So some of you guys, a lot of you guys are starting to do surgical procedures, or some of y'all are OMS, or some of y'all just do like full arch. I learned what that is the other day. All right. So some of your treatment rooms are going to be air conditioned or climate controlled different than what your lab and stereo are in your break room, right? But then you got all this storefront glass in the front, got a long hallway, got a mechanical room, and these other rooms, console rooms, right? All that stuff in the front. So you stage out some of that stuff. Sometimes you guys are having, instead of 2 air conditioning units, HVAC units on the roof, which we normally see, now we're starting to see 3 because of all the surgical procedures. Because you want those treatment rooms to be climate controlled and you want them cool, right? You have to have them cold because you want them sterile. And then you want all the ventilation separate and different, right? So your mechanical typically is one of your higher numbers when it comes to your startup, especially if you're doing procedures, specialty procedures, because you'll have different zones and stuff like that. Well, your electrical is just always high because, us electricians like to get paid. So, we like putting a lot of power. We like putting a lot of lights. Want you guys to be able to see what you're doing and stuff, even though y'all use loops. But we don't typically want like industrial, we don't want it to look like a Home Depot or a Lowe's. You go in there and it's very bright, like a gas station or an airport. Anyway, so we want aesthetically pleasing on your electrical and your lighting. Plumbing, it's all in the ground. You don't see it. I don't know why plumbers want to get paid so much anyway, but hey, that's a topic for another day. MEPs, mechanical, electrical, plumbing, that's what that means. It's your 3 biggest in your startup. You have to look out for them. You have to figure out how to VE those. Remember we talked about VE in the last video. You have to look how you can VE that as much as possible without having to run extension cords or whatever because you didn't put enough plugs in there. All right, see you guys in the next one.